So OtoNexus Medical Technologies is developing the world's first medical device for the accurate diagnosis of middle ear infections in children and also in adults, and in particular for making the key differentiation of antibiotic versus no antibiotic. So middle ear infections, called Otitis Media, are the #1 reason for antibiotics in kids and the #1 reason for surgery in kids, yet clinical studies show that doctors get it wrong 50% of the time, particularly in the key differentiation of antibiotic versus no antibiotic. And it's not the doctor's fault. The technology in this space is really very old, and there's no technology that exists today that can differentiate a viral from a bacterial infection. So you take your child into a pediatrician or some other primary care physician, and it's usually a visual inspection of the outside of the eardrum, an attempt to guess what's going on behind that eardrum. This technology, using ultrasound in a completely novel way, ultrasound very well known, very completely safe, can detect not only the presence of infection, but also the type of infection. So therefore, the clinician can instantly determine whether or not to prescribe an antibiotic. The CDC tells us that we prescribe antibiotics in 85% of cases of otitis media or middle ear infections, and we should prescribe in just 15% of those cases. We believe by accurately providing the data that the doctors need to differentiate when and when not to prescribe, we can cut antibiotics for otitis media by 50% or more. And remember, this is the #1 reason for antibiotics in kids. So that's a very, very significant impact. It uses Doppler Ultrasound, and it just fits right into the process of a doctor used today. The doctor today will use an otoscope to look at the outside of the eardrum. This device is very consciously designed to look, feel, and act very much like an otoscope, except that it has the button for the Doppler Ultrasound. You can take pictures, you can take video of the eardrum and the inside of the ear, show it to the parent, and in 1 to 2 seconds, have an accurate reading from ultrasound that accurately identifies exactly what course of treatment is required for this particular child. And in children, it's very, very important that we reduce antibiotics, generally important to reduce antibiotics, but kids more so. One of the things that we know now from the CDC is that if we prescribe an antibiotic too soon or too often, we're actually suppressing that child's immune system, preventing them from actually creating the antibodies that are necessary to fight that bacteria. So we're actually predisposing that poor kid to the next infection and the next and the next and the next. In adults, it's a little different. What we're looking at in adults is much more ruling out otitis media in order to rule in something much worse. I was just speaking with a woman here at this very conference who, you may have heard earlier, her talking, who said that she was misdiagnosed for months with middle ear infection, otitis media, given lots of antibiotics, and much later, properly diagnosed with throat cancer. Now, her throat cancer was allowed to progress without treatment because she was misdiagnosed. Had any one of those doctors had this device, they would have instantly known, not an ear infection. Our inventor is Dr. George Gates, who is a well-known otolaryngologist and researcher in otitis media, world known. And he has been for 40 years looking for a better solution. He's been very frustrated with this 50% error rate in diagnosis, frustrated with performing these surgeries on these kids that he knew were unnecessary. And if we could do a better job of diagnosis up front, we could do a better job of treating these kids. And so he's been looking and looking and looking over the decades for a proper solution. He got transferred to the University of Washington, Seattle, Washington, ultrasound capital of the world, and said, ultrasound, let's try that, and came up with the perfect solution. And he and Dr. Mark Mooring, who's our chief technology officer, worked for about 10 years to develop out this technology. We're in a very special place. We have this wonderful, elegant, easy-to-use tool that can not only dramatically improve patient care and patient outcomes, but also very significantly reduce the cost of care. That's a special place to be.